With us today is board-certified plastic and reconstructive surgeon, Dr. Jeffrey Scott. Dr. Scott, we thank you for joining us again today.
Great to be here as usual.
Today we thought we would focus in on an area that I know is of great interest to many women, and that is the area of breast surgeries. We thought we would begin by overviewing exactly what is done in the office of a plastic surgeon.
There's always breast enlargement with breast implants. There's also breast reduction in women with excessively large breasts that have problems related to that. So reducing the size of the breast is another type procedure. And another type of cosmetic surgery of the breast would be mastopexy, or a breast uplift type procedure for the droopiness. Obviously that can be done with or without implants. And then finally, there's always the topic of breast reconstruction in women that have had mastectomies for breast cancer. One of the unfortunate facts is that breast cancer is a fairly common cancer. There's a number of breast-sparing type procedures that can be done with smaller type cancers, but it's still the standard modified radical mastectomy, where the breast itself is removed, is a very commonly used procedure, and there's a lot of women that don't want to accept the post-mastectomy deformity and seek to have breast reconstruction.
This is something that, as I understand, if I understand it correctly, works well if you are working with the oncologist or early on in the procedure?
Yeah, I think that in most incidences it at least gives the woman a level of comfort to talk with if they're even considering breast reconstruction, either at the time of the mastectomy or in the future, to sit down ahead of time and speak with a plastic surgeon so that they understand what their options are. And there's a certain level of comfort in that, even if they don't plan on having the reconstruction for 6 to 8 months. At least they know once they've had the mastectomy that this is not their permanent situation, and there's hope, for them. So my preference is certainly to talk to the women so they know their options, before the mastectomy.
Now, you mentioned if they determine they don't want to have it for 6 to 8 months. Is there a time frame where it would be better for this procedure to be performed?
No, not really. With breast reconstruction, the options are primarily to have it done immediately at the time of the mastectomy, or as a delayed procedure. Now, whether that's 3 months, 6 months, a year, 2 years, is really immaterial once it is not done immediately. So really the time frame is up to the individual. There's some other factors involved as far as whether there'll be the anticipated need for chemotherapy afterwards and things like that. But in general, it's pretty much up to the woman as to when or what stage along the way she wants to have it done.